Assalamualaikum warahmatullahi wabarakatuh, and very good morning to all of you. So this is my recorded version of presentation about video nystagmography. I'm Puan Roshila binti Bujang, audiologist from Hospital Kuala Lumpur. Video nystagmography or VNG is a complete diagnostic system for recording, analyzing, and reporting eye movements by using video imaging technology, which video goggles with infrared cameras are used. This test includes a series of tests used to determine whether a vestibular disease may be causing a balance or dizziness problem. So this test can detect ocular motility abnormalities, which may be spontaneous or induced, and reflect the effect of the balance disorders on the ocular system due to its connection with the vestibular apparatus. In this test, we measure the involuntary eye movement, which we call it as a nystagmus. So this nystagmus or this eye movement can be a slow, fast, steady, or jerky. It happens when the brain gets conflicting message from the eyes and the balance system in the ear. So this conflicting message can cause you dizzy. So you can briefly get nystagmus when you move your head at a certain way or look at some types of patterns. But if you still get it when you don't move your head, or if it lasts a long time, it may means you have a disorder of the vestibular system. There are three parts of the VNG or ENG testing. They are ocular and optokinetic testing, or usually we call it as oculomotor testing. So this may indicate a central or neurological problems or problem in the pathway connecting the vestibular system to the brain. And the second one, we call it as a positional nystagmus or positional testing, which in this test we're looking at the positional changes and their effect on your vestibular system. So we measure the nystagmus after we change the position of the patient, the body position of the patients. And the third one is we call it as a caloric testing. So this test assess your vestibular system for each year and reveals whether they are working and responding to the stimulation. So this test we conducted by using the warm and cool water or air. So now we go to the technique of the VNG. So this test aims to see the patient's eyes even in complete darkness. So we will examine the eye movement of the patient by using a set of goggles. So in the goggles, we have a infrared lights which will lights up the eyes of the patients, but the room is in the total darkness. Then the infrared camera will capture a video of the eyes movement, and then there are a special algorithm which can detect the center of the pupils, and the pupil's center marker will move along with the eyes. So it's a very sensitive camera, and it will detect even a very small movement of the pupils. Then we can get the tracing of the pupil center movement. The gold standard for evaluating dizziness, balance, and visual tracking disorder, which involving the vestibular system. So in this test, we using to investigate or we study the oculomotor pathway in the brainstem and cerebellum, which required for the function of the vestibular ocular reflex. So the subtest is Saccades, Morphosus, and Optokinetic. Before we proceed with the testing, we will ask the patient to follow a certain simple instruction before come for the appointment for the testing. So we advise to avoid taking alcohol 24 hours prior to the testing, and also the medications which will suppress the vestibular response, vestibular activity, neuronal activity, which can affect the results, such as the beta cell, antidepressant, antihistamines. And also we will ask to avoid to use the eye makeup, such as the mascara, because we want to prevent from the camera, the light infrared camera, to misfocus the pupils. And during the testing, we must ask the patient to keep eyes open and avoid from become drowsy and distracted with the other sound or other distraction. And also we ask them to avoid from blink the eyes excessively, and we will keep on asking whether they understand the instructions, and they will ask to keep their hands off of the goggles. This is a picture showing the chair which we use when conducting the VNG Oculomotor Test. So in my clinic setting, I used a similar chair that was used to perform the rotating chair. So patient will instruct to sit on the chair with head upright, looking forward. Then we put on the goggles with infrared camera. The goggles shown in this picture are monocolor goggles, but for oculomotor VNG test, it's best to use the binocular goggles, where both eyes can be seen. After that, instruction will be given for each sub-test, and the room lights will be turned off before the test is carried out. Before we move on the next explanation, I will explain on how to read the recorded tracing of the eye's movement, or nystagmography. So for the horizontal eye movement, for example for the left beating, when the eyes move to the right, the line will goes up, and when the pupils move to the left, the line is go downward. The steepness of the line will indicate the phase of the eye's movement. So for the steeper lines will indicate the fast movement, while the flatter lines will indicate slow phase eyes movement. So the first phase will show the direction of the nystagmus in degrees per second. For vertical eyes movement, the resulting tracing is as shown here. The upward movement of the eyes will produce an upward line, while the downward eyes movement will produce a downward line. Just like the horizontal movement, the steeper line will indicate for the fast phase, and for flatter line will show for slow phase. Okay, now I will explain on how to perform the oculomotor test. So we start with the first subtest of the oculomotor testing, a saccadic eyes movement, or the fastest eyes movement, which enable us to rapidly redirect our line of sight. And this eye movement produced and controlled by a number of central structures of the central vestibular system. So this test able to test or assess the patient's central vestibular system. Before we start with the test, we advise to perform the calibration test, or a process of relating the eye's position to the eye's movement recording device. So it is a similar procedure to assess Saccades movements. And let's start the test. We instruct the patient to follow the stimulus, then gaze to the left and back to the center, and gaze to the right and then back to the center. So this is the video on how we present the stimulus. So the stimulus will move to the right, to the center, and to the right, to the left and back to the center. For Saccade, each target will move for about 3 seconds. So let's take a look on how we analyze the tracing. First, we must look to both the parameters and also the graph. So there are 3 parameters: latency, velocity, and accuracy. So latency refers to the difference in time between the presentation of the target and the beginning of a circuit intended to acquire that target. Or it means that how long it takes the patient's eye to find the target. So the mean latency is about 104 to 365 milliseconds. And then for the velocity, or how fast the eyes are moving from point to point, the normal range is about 210 to 430 degrees per second. And the third one, the accuracy, which refers to the prevalence of saccades that are longer than appropriate for the target displacement, or we call it as a overshooting, and smaller than needed for undershootings. Or we can also refer it to as hypometria and hypermetria. And usually after they are making undershooting or overshooting, the patients will make a corrective saccades back to the target. So the target must more than 50% accurate for normal saccades. For both undershooting or overshooting, we classified it as abnormal when it is reproducible and significant. So as we can see here, abnormal value of these parameters may indicate cerebral lesion. These are an example of the tracing which shows the difference of normal saccade and abnormal saccades. So for the A tracing is referred to as a normal tracing. So as we can see, the tracing is smooth and follow the target accurately. And for the B, shows the tracing with slow saccades. It means that the eyes move slower or the velocity for a particular amplitude is less. But this also sometimes can happen if the patient become drowsy. So C shows the hypometric saccades or undershooting saccade. So it happens when the initial saccade is too small and the corrective continues onward and towards the target. And for D shows the hypermetric or overshooting saccades eye movements. This can be happen when the initial saccade is too large and then the corrective saccade occur in the opposite direction to the target displacement. So for the hypometric saccades, we can it will suggest lesions which affecting the cerebellum, and for the hypermetria, or when the movement is exceeded the target, it may be due to the lesion in the cerebellum. And for the E tracing shows the eyes make a stop before reach the target or saccade. It also may due to lesion in the cerebellum. Now we move to the second subtest of the VNG Oculomotor testing. It is a smooth pursuit movement. This movement will assess the patient's ability to accurately track a visual target in a smooth and in a controlled manner. It will interpose with the catch-up saccades. So this slow eye movement will maintain the image of a small moving target on the fovea. So for this eye movement, we will assess the patient's central vestibular system. So for normal patients, they're supposed able to perform smooth pursuit tracking and produce a tracing in which the stimulus and the response are identical. In this slide, I will show you the screen from our clinic for example of a stimulus movement during an oculomotor smooth pursuit test. So the target will move smoothly to the left and right at a frequency of 30 Hz. So this test will measure the ability of subjects to match the eye movement to the visual target movement, or on how the eye is able to track and maintain the image of small moving targets upon the fovea. So fovea is a tiny bit located in the macula of the retina, which are responsible for sharp vision. Now we go to how we analyze the smooth pursuit tracing. So usually we will perform the test for 2 to 3 attempts. So sometimes we do need to instruct the patient on how to do the test. So because this is we intended to prevent the patient from drowsy or close their eyes. So and during the test, mental tasks should be carried out to ensure that they remain awake and alert. For smooth pursuit, two parameters are used to quantify the smooth pursuit tracing. They are gain and asymmetry. Gain refers to eye velocity or eye velocity divided to target velocity, which measured during the most linear portion of the sinusoidal within this red box. And asymmetry refers to gain difference between leftward or upward for vertical versus rightward or downward for the vertical target motions. On the right side, in this slide, we can see the screen in our software, which we can see the smooth pursuit below here. There are studies shows smooth pursuit response can be influenced by age factors because it most likely result from age-related neurodegeneration in specific visual motor pathways. So therefore, it recommended to obtain own 5th percentile lower limits norms for each clinical settings. So when the result shows a low gain value of less than 0.8 and not symmetrical, it will suggest for cerebellar lesions. So for an example here, as we can see here, the abnormal tracing is poor with poor morphology as compared with the target. So now we go to the third subtest of the VNG. It is a optokinetic or OPK. OPK is a reflexive eye movement evoked by following of moving fields to stabilize the retinal image. So in our daily life, we can, for example, when we're riding in the car, while the car is moving forwards, we look it up to the window. Through the window, we can be able to see the objects outside clearly. So this is when the OPK movement is normal. So in this test and in this subtest, we will assess the patient's ability to keep the multiple moving objects, the entire visual field on the fovea. So it consists of a slow, smooth tracking movement, slow phase in one direction, and a rapid resetting saccadic movement or fast phase in the opposite directions. So in this subtest, we will present the visual stimulus in the dark room projected on the wall. So as shows here, there are stripes black and white moving to the right and to the left to create a moving visual field. So, but we can also make a choice to use other pattern of stimulus which are available in the software, depends on the patient's comfort. So this video shows response during the testing in the software screen. So this is an example of a normal OPK tracing in our screen software. So the tracing consists of slow, smooth tracking movement in one direction and a rapid resetting saccadic movement in the opposite direction. So the table here shows the velocity of the stimulus and eyes velocity and also a gain. So how we analyze the response? There are two parameters to quantify the OPK tracing. It is a gain and asymmetry ratio. So gain is an eye velocity divided to target velocity, and asymmetry refers to difference between slow phase velocity gain for left and right movement. So normal value for OPK gain are similar with the smooth pursuit but slightly lower at the high frequency movement. So normal value should be more than 0.70. So but sometimes the OPK stimulus will disturbing to some patients during the test. Therefore, it can vary substantially in the same individuals from trial to trial. So averaging can be used to overcome this problem. So the result can be complete loss of OPK or significant asymmetry. So for complete loss, OPK commonly happen in a patient with a bilateral loss, such as a patient with antibiotic-induced ototoxicity. Or it may happen in patients with a central lesion that affect the vestibular connections. For significant asymmetry, it may be due to CNS pathology, central nervous system pathology, or following complete unilateral peripheral vestibular loss. So the result must interpreted carefully to differentiate its response from peripheral and central lesions. This is a graph of gain asymmetry for both direction. The black line represent as a gain and the blue line represent as a response. So it is normal when the response has a minimal gap with the gain to both sides, left and right. But for abnormal tracing, there are a large gap with a normal gain line. So that's all about the subtest of the oculomotor testing, Saccades, smoke pursuit, and optokinetics. So now we go to how we analyze the oculomotor test. So all the subtests must be analyzed with caution because it may be affected by certain type of drugs that has been taken and also attention of the patient during the test. It can be affected due to age factor, in old age, inattention, poor vision, sedation, sleep deprivation, and medications. And these factors should be considered during the testing. Therefore, we suggest to repeat the test at least 2 times for each subtest. So after that, we must integrate all the oculomotor subtests to get an information regarding the central vestibular function. So any abnormalities will denote the presence of central lesions. So this info is useful in making diagnosis of vestibular problem besides other vestibular assessment that we have. So that's all about the video nystagmography or VNG for oculomotor subtest. So thank you for listening.